Benadryl Plus Congestion is an over-the-counter medication that combines two active ingredients, diphenhydramine, an antihistamine, and phenylephrine, a nasal decongestant. This dual-action formula is designed to provide short-term relief from symptoms of the common cold and allergic rhinitis. It is available for adults and children in both tablet and liquid forms, including generic versions. What Benadryl Plus Congestion is used for. Benadryl Plus Congestion, diphenhydramine/phenylephrine, helps relieve a range of bothersome symptoms, including runny nose, sneezing, itchy nose or throat, itchy watery eyes, stuffy nose caused by nasal congestion, sinus congestion and pressure. These symptoms often appear with allergic rhinitis, seasonal allergies, or the common cold, and this medication offers temporary relief so you can feel more comfortable throughout the day. How Benadryl Plus Congestion works. This medication works through two different but complementary mechanisms. Diphenhydramine, a first-generation antihistamine, blocks histamine, a natural chemical in the body responsible for allergic reactions. By reducing histamine activity, it helps relieve sneezing, runny nose, and itchy, watery eyes. Phenylephrine, a decongestant, works by narrowing blood vessels in the nasal passages. This reduces swelling and sinus pressure, providing relief from nasal congestion. Together, diphenhydramine and phenylephrine target both allergy-related symptoms and sinus pressure, making this combination especially helpful for those struggling with allergic rhinitis and cold-related congestion. Possible side effects of Benadryl Plus Congestion. Like many medications, Benadryl Plus Congestion can cause side effects. Most are mild and improve as your body adjusts, but it's important to monitor how you feel and contact your healthcare provider if symptoms persist or worsen. Common side effects may include sleepiness or drowsiness, dizziness, restlessness, dry mouth, nose, or throat. Other possible side effects include nausea or vomiting, headache, trouble urinating. Because diphenhydramine is known to cause drowsiness, it's best to avoid driving or operating heavy machinery until you know how the medication affects you. Benadryl Plus Congestion, diphenhydramine/phenylephrine dosage forms, typical dosing, and contraindications. Benadryl Plus Congestion, diphenhydramine/phenylephrine, is available in both tablet and liquid formulations. This over-the-counter medication is commonly used to provide relief from symptoms of allergic rhinitis and the common cold, including nasal congestion, sinus pressure, sneezing, and itchy, watery eyes. Dosage forms and cost. The combination of diphenhydramine and phenylephrine is made by several manufacturers and may also be available in generic versions. Prices vary, but the average cost for 30 tablets of 25 mg diphenhydramine and 10 mg phenylephrine is approximately $10.37 with a GoodRx coupon, which is about 24% off the typical retail price of $13.65. Examples of dosage forms include tablet. Each tablet contains 25 mg of diphenhydramine and 10 mg of phenylephrine. Children's liquid suspension. Each 5 milliliters contains 12.5 mg of diphenhydramine and 5 mg of phenylephrine. Typical dosing guidelines. Always read the instructions on the product packaging or consult a pharmacist or healthcare provider for personalized advice. Standard dosing is as follows. Benadryl Allergy Plus Congestion Tablets. Adults and children 12 years and older. 1 tablet by mouth every 4 hours as needed. Do not exceed 6 tablets in 24 hours. Children under 12 years old. Ask a pediatrician before use. Children's Benadryl Allergy Plus Congestion Liquid. Adults and children 12 years and older. 10 milliliters by mouth every 4 hours as needed. Do not exceed 60 milliliters in 24 hours. Children ages 6 to under 12 years. 5 milliliters every 4 hours as needed. Do not exceed 30 milliliters in 24 hours. Children under 6 years old. Ask a pediatrician before use. Contraindications for Benadryl Plus Congestion. There are certain health conditions and situations where this medication should not be used due to safety risks. Inform your healthcare provider before taking Benadryl Plus Congestion, diphenhydramine/phenylephrine, if any of the following apply. You are currently taking or have taken in the past 14 days a monoamine oxidase inhibitor, MAOI, a type of medication often prescribed for depression or Parkinson's disease. Pharmacist tips for Benadryl Plus Congestion, diphenhydramine/phenylephrine. Benadryl Plus Congestion, diphenhydramine/phenylephrine, is an over-the-counter medication used to relieve symptoms of nasal congestion, sinus pressure, and allergic rhinitis. While effective, there are several important safety considerations to keep in mind. Drowsiness and alcohol use. Diphenhydramine, one of the active ingredients, can cause drowsiness, dizziness, and difficulty concentrating. Until you know how this medication affects you, avoid driving, operating heavy machinery, or performing tasks that require focus. Drinking alcohol can intensify these effects and should be avoided. Children and sleep concerns. Never give Benadryl Plus Congestion to children in order to make them sleepy. While diphenhydramine often causes drowsiness in adults, it can have the opposite effect in children, leading to hyperactivity. If your child is having trouble sleeping, speak with a pediatrician or pharmacist about safer alternatives. When to seek medical attention. This medication is only intended for short-term symptom relief. If your symptoms last longer than a week, worsen, or are accompanied by fever or rash, contact your healthcare provider. These could be signs of an underlying condition that requires further evaluation. Possible side effects. Stop taking Benadryl Plus Congestion and call your healthcare provider if you experience troubling symptoms such as dizziness, nervousness, or difficulty sleeping. These may be caused by the phenylephrine or the combination of ingredients. And in some cases, an alternative medication may be recommended. Drug interactions. Do not combine Benadryl Plus Congestion with other antihistamines or decongestants without consulting a healthcare professional. Doing so increases the risk of serious side effects, including seizures, hallucinations, severe drowsiness, high blood pressure, or even life-threatening complications. This medication should also never be taken with a monoamine oxidase inhibitor, MAOI, such as selegiline, phenelzyne, Nardil, or tranylcypromine, Parnate. Combining them can lead to dangerously high blood pressure. If you have used an MAOI within the past 14 days, ask your provider about safer treatment options. Pregnancy and breastfeeding. If you are pregnant or breastfeeding, do not take Benadryl Plus Congestion without first discussing the potential risks and benefits with your healthcare provider. Current research on its safety during pregnancy and breastfeeding is limited. Liquid formulation tips. Store liquid Benadryl Plus Congestion at room temperature, in its original bottle and away from light. Always measure doses with the provided cup or syringe to avoid taking too much or too little. Household spoons are not accurate for dosing. Some liquid formulations may contain sodium. If you are on a low-sodium diet due to conditions such as heart failure or kidney disease, ask your healthcare provider before using this product. Benadryl Plus Congestion, diphenhydramine/phenylephrine, can be helpful for short-term relief of nasal congestion and allergy symptoms associated with allergic rhinitis or the common cold. However, safe use depends on proper dosing, awareness of side effects, and avoiding harmful interactions. For more clear, science-backed guidance on medications and health conditions, subscribe to HeInfo, your all-in-one destination for trusted, science-based health information.